move on to the upper extremities. You can still have your patient sitting for this portion.
Still with your patient sitting, moving on from the neck, moving down, we're going to go to the upper extremities. So starting with inspection, we're going to be inspecting the skin and nails. We're going to be looking for size, shape, symmetry, color, really looking at, in particular, on the peripheries, the hair distribution, lesions, and then when looking at the hands, we're looking for cleanliness of the nails, looking for fungal infections, looking for clubbing on the nails.
So after we've assessed that and it looks symmetrical, which it does, I'm going to be assessing for muscle strength. So
After inspection, you're going to assess for muscle strength. Here I'm having her grip my fingers. I say grip my fingers as hard as you can, and you're going to want to be able to grade that. So remember, 0 is a flaccid strength and 5 is full strength. Have the patient push against your arms and pull against you to test muscle strength of the arms. Again, grading 0 to 5. So Professor Bird here, I graded her a 5 out of 5 for strength.
Next, you're going to palpate the skin, and again, you're going to palpate for temperature.
After testing the strength, I'm palpating now for temperature using the dorsal side of my hand and just feeling for symmetry and temperature of the arms.
Make sure it's not
Also palpating the upper extremities for any masses, tenderness, or lesions.
So this could be lumps. Now you're going to palpate with the pads of your fingers, checking for any lumps, abnormalities, lesions, which I don't note any, so that's a normal finding. You're going to assess for skin turgor. You can do skin turgor in a couple.
And next you can assess skin turgor. You can test for this on the chest in some patients, but I prefer to do this in the arm just because it's more accessible. I don't have to go underneath the gown. So you're just going to very lightly pinch the skin and wait for the return.
And then you're going to move down to the hands. Here you're going to inspect the nails for capillary refill and clubbing.
Next you're going to inspect the nails for capillary refill. So you're going to pinch the skin and see how long it takes for the color to return. It should be under 3 seconds. And then you're also looking for nail clubbing.
So that is normal finding with cap refill. And again, you can do this at the same time. So you're just watching for that color to return. Under 3 seconds is brisk. And then I'm going to have you just put your fingernails together like that.
In assessing for nail clubbing here, I'm having Professor Bird hold her nails together, and I'm looking at that nail bed angle, and you want to see a small window between the nail bed, between the bilateral nail beds. If not, that could indicate clubbing, which is a sign of chronic hypoxemia.
So it is something you want to check for. And then I'm going to assess the 2 peripheral pulses on the upper extremities, which is the brachial and the radial pulses.
And then on the upper extremities, we're checking 2 pulses. We're checking the brachial pulse, so you can do that at the same time to assess for symmetry. And then moving down to the radial pulse on the thumb side, checking for symmetry there as well.
Really light.